In this video tutorial, we're using the brand name HEPA card for detection of hepatitis B surface antigen in a patient's blood or serum. To be noted, the procedures that we are going to be mentioning here differs from kit to kit or brand to brand. So it is advised that you go through the kit insert or the manufacturer instruction manual that comes along with the kit thoroughly before starting any test. Before doing any test, you're going to look at the test kit box and look for the sign that shows the temperature at which the test kit is to be stored and the expiry date as well as the lot number. You are going to make sure that the test kit is not expired and that the test kit has been stored within the correct temperature. Before starting the procedure, you're going to clean your working area with 70% alcohol in a unidirectional method, that is from side to side or from up down. Then you're going to take out the reagents and the kits from your box and lay it down one by one depending on the number of tests that you're going to conduct over the tabletop. Next, you're going to take out your manufacturer test kit insert and you are going to read through it carefully and follow the steps as written in the insert. Prior to performing the test, you are going to prepare your samples first. Either you allow your sample to stand. For blood sample that is collected in both red cap vial or for EDTA vials, you can centrifuge the sample at 3000 G for 10 to 15 minutes so that you can procure the serum or plasma that is required for performing the test. For red cap vials, you can just allow the blood to stand for around 30 minutes to 1 hour so that you allow the blood to clot and only serum will be formed. You can use that serum for performing the test. When you take out the reagent and kits from the box, you are going to take out the specific number of test kits or reagents that's required according to the number of tests you are going to perform. You are going to lay them down over the tabletop and label them either according to the lab ID number that you have given to each test sample or either according to name of patient with age and sex depending on whatever is feasible or easy to you. After the sample has been centrifuged or after the sample has been allowed to stand for 30 minutes to 1 hour, with the help of a pipette that usually comes along with the test kit box, you are going to pipette out few drops of the serum or plasma and you're going to add this serum or plasma to the sample pad window that is present in the rapid diagnostic test kit. For this particular test, that is for HEPA card, we do not require a buffer solution. We allow the test kit to stand for at least 20 minutes. Test results should not be read beyond 20 minutes as it can give either false positive results. Once you have conducted the test, you are going to throw the used kits into a color-coded bag that is red in color for disposal. Your micro pipette tips or your pipette tips that comes along with the test kits that have been used can be thrown either in a clear container, which later can be thrown in a red colored bag, or you can throw it directly into a red colored bag. Lastly, you are going to wipe your working surface again with 70% alcohol, either from side to side or from top to bottom. You're going to put back all your test reagents into the test box kit and you're going to keep it back either at room temperature or in a refrigerator depending on what temperature it's supposed to be kept. Test interpretation for hepatitis B. For valid tests, the control line should appear in all the kits. If there is appearance of no colored line at the control region, means that the test is invalid and should be repeated with a new test kit from the same box or from a different box using the same sample. For positive results, 2 lines will appear, one in the control line and one in the test line. And for negative results, only 1 line will appear, that is only in the control line.